Good evening. My name is Angela Berry. You can call me AJ for short. So today we're going to be talking about malignant hypothermia. Just to give you a backdrop of what malignant hypothermia is, it's a severe reaction to certain drugs from used for anesthesia. The severe reaction typically includes a dangerously high body temperature, rigid muscles or spasms, and a rapid heart rate and other symptoms. So in the assignment, we were asked to basically describe an emergency, given the procedure, type of anesthesia, the position, and at what point in the procedure would this occur. So I have a case study that I actually found, and I would like to then go back in and kind of discuss what happened and why. Tom Jones is a healthy 18-year-old scheduled for a left ankle arthrodesis. Tom weighs 165 pounds, so 75 kilograms. During the preoperative assessment, the nurse notes that he was diagnosed with Becker muscular dystrophy at age 17. He does not use any ambulatory assistive devices. His past surgical history includes a tonsillectomy at age 7, and there is no other significant health history to report, and no history of problems with anesthesia. Okay, so now the surgery has been going on for about 15 minutes. The patient is under general anesthetic with a left 18 gauge antisubital IV. You enter the room to relieve from your lunch break, meaning you're coming in. The patient's already on the table. It's been 15 minutes. You receive the following report. Okay, this is Tom Jones, 18-year-old, left ankle arthrodesis, 2 grams of cefazoline administered, and no known allergies. Because remember, in his chart, there were no problems of anesthesia. So, he does not use any ambulatory devices. There is no history except for a tonsillectomy. We just started. See you in 30 minutes. So, the exchange happens 2 minutes after the person you relieve for lunch. The patient's temperature is 39 Celsius. His BP is dropping. His heart rate is 90 with periodic premature ventricular contractions. The patient's vitals continue to change over the next 1 to 2 minutes. The BP is now 70 over 30. The temperature is 42 Celsius. And his CO2 levels are increased to 65. The anesthesia provider announces their suspicion of malignant hypothermia. So this patient is under anesthesia and is now experiencing malignant hypothermia, meaning he's overheating. What do you do as a surgical technician? As the surgical technician, in my opinion, I believe that whatever the surgeon and the circulator are asking you to do, all hands on deck, needs to be done. Because you're in sterile gown, first of all, you can't break sterility. So hopefully there is the malignant hypothermia crash cart near, because that, and I actually also put together a binder to talk about what we would do in the event of a malignant hypothermia emergency. Now, the malignant hypothermia emergency also has a cart involved. So let me just go to what we wrote about in the cart. Okay, so in the first, there's a malignant hypothermia cart. In the first drawer, you're gonna have syringes. Now, depending on your facility, the cart might not always be the same. The second drawer, you're gonna have dantrolene 20 milligrams vials and vial spikes. The third drawer, you're gonna have sterile water, 100 milliliter vials, lab supplies, tubes, and IV supplies. Because remember, you're right in the middle of an emergency. So you're having to basically cool this person's body back down so that he doesn't die on the table, because It happens quick. What happens when your body continues to heat up? You're destroying enzymes. It's basically like you burning from the inside out. And it's destroying tissue and everything else is breaking down as quickly as possible. So in drawer 4, you're going to see sodium bicarbonate, lidocaine, calcium chloride, dextrose, furosemide, esophageal temp probe. In the 5th drawer, you're going to have ice packs, disposable ice packs, basin, and charcoal filters. In the 6th drawer, you're going to have temperature monitoring, urinary catheter, atrial line supplies. Because your blood pressure is dropping as well, you're experiencing just the entire OR staff is trying to react quickly. The number one thing that we want to do in these type of emergencies is to cool the patient down and inject him as well. So you're going to call the stat team. You're going to go ahead and do what you need to do in the first 3 steps. And now this is where the nurses take over. As the surgical tech, you are not allowed to mix, administer, give, inject any kind of medication. Your job is to do whatever the surgeons and everybody else is asking you to do. And you'll also receive training in case of these type of emergencies that happen. Because as a surgical tech, we are not surgeons. We are not equipped to handle certain situations, although we are expected to know what to do in an event of an emergency. So the roles and the responsibilities in your chosen emergency. How did I come to see these conclusions? Well, we talk about different types of emergencies at work because I do work in sterile processing and I'm close to the OR. Some of the informational meetings that we do are to talk about different events that have happened. So for an example, we had a case with L&D and the mother was compromised while giving birth to a baby, and there were a lot of staff that was called in order to help and to help diffuse the situation as an emergency. So in conclusion, as the surgical tech, it is important to understand, ask questions, and know what to do in the event of the emergency. Know if your facility has an emergency plan on each type of area, familiarize yourself with it, and always be able to ask the right questions and know what to seek for, because there may be something that you would catch, and to let the circulating nurse know or to let someone know that you caught that somebody else didn't. I hope that you enjoyed the presentation. I hope that you got information out of what I discussed today. Again, today's topic was malignant hypothermia. Thank you so much. Have a good night.